Hey everyone, it's been a few weeks since the last video, so just putting another one random topic, see what we talk about out there. The last one was about keeping a cool head in a tough market, just because in chat, followers on X, etc., a lot of people, a lot of you guys saying how tough it's been to stay in good headspace when your portfolio's starting out as badly as we have to start the year. Um, when it seems like you're a punching bag in each day. It's either a portfolio specific news, stocks you own, or simply the overall market, tariffs this, trade war that. Uh, so definitely worth checking that one out if you haven't already. Related story, while I was in Costa Rica, this is coming to you now from back in the States. I've been here a week and change. I went to a pharmacy and I was getting loperamide for that's traveler's diarrhea medicine. And the pharmacist asked me, "Do you need it? Like, are you doing okay? What else can I get for you?" And I said, "No, it's fine. I just like to have this stack of medicine just in case wherever you travel. Better safe than sorry." And she said to me in Spanish, it's something similar. Mejor prevenir que lamentar. Mejor prevenir que lamentar. Better to prevent than to lament, basically. And that saying applies to everything, including in our portfolios these days. I've noticed I mentioned this to you guys last year, Q4, a number of binary losers that I could have easily avoided. Those felt like unforced errors. And that would fall in this category too. Like, what can we prevent instead of having something happen to us and losing dollars? What are all the things we can do to prevent losing money in our portfolios? So for me, one of those was I recently eliminated the last few, early stage ideas from my portfolio. I took like a 40% loss in Acrivon on their endometrial readout. Again, that was entirely on me. In this atmosphere, I should have had that money in my late stage or commercial portfolio. It could have been worse, but again, just dollars that were lost that didn't need to be lost. So for me, applying that saying means I eliminated anything preclinical or early stage clinical from my portfolio. So 70% or more of the portfolio is in commercial stage companies. Something more solid like ARS Pharma, for example, with the Neffy launch that's been doing well, and you can see here during all the recent volatility, it's held its own at least, which has been nice. And 30% of the portfolio in late stage clinical companies. So that's either, they have phase 3 results in hand, regulatory submission. But again, I'm just trying to sidestep as much risk as I can. So that comes down to that saying again. A related item for me is, improving my selection criteria as much as possible. I shared a quote recently. I think that was a Craig Groeschel quote that is, growth and comfort never coexist. When things are going the most difficult for you is usually when the growth happens. It sucks while we're going through it. Whether that's market volatility, something personal, like when I went through my divorce, etc., something that's entirely unpleasant. But on the other end, you're super happy for or thankful for what it did for you, in you, etc. And so I would be, biotech bear market starting, 2021 has been anything but fun. I know a lot of you guys would say the same, as we said, waking up, being a punching bag. But on the bright side, it's made my selection criteria a lot better. So one thing I do, you guys have heard me mention, is Playbook. It started on my phone a few years now. I publish it too, but it's basically setups that are already vetted, that I've done the due diligence on. I have a trade plan in place, and if and when dollars free up, I have those prioritized based on which ones are most timely, most actionable, highest upside, best meet my criteria. So this list in front of you is not my playbook. It's just DDQ, companies that I want to do some due diligence on and see if they fit my criteria. But again, the idea is having, you could probably do something similar. I have it shorthand on my phone. I published last week the most recent one for ROTY. So for an example, Arcutis was a full-size position for me, and at highs along the way I took partial profits. So now it's down to only around 4% portfolio weighting. It's been pulling back here. The 200-day moving average is, in the high 11s. So in playbook, what I wrote is, on pullback to 12 or below, I'd like to re-add to that position, maybe, increase it up to my maximum allowed of 10% portfolio weighting. Enterprise value closer to 1.2 billion would be around 1 times peak sales for Zorev, especially if you think they'll take significant market share from topical steroids. The market also punished the company, the stock, because the CFO left. So they see that as a negative. Maybe there's read through that there's negative read through. There's no buyout coming. I think that's reading too much into it. There was a recent IP news that helped clear an overhang for them, a stay on litigation. They have a fourth indication with a PDUFA date in May, which would be a pretty big one, scalp and body psoriasis, where there's been lack of innovation. So again, this is just an example of having an idea in playbook. If it pulls back to the $11 range, great. I get to prioritize this one. I prioritize my commercial launch setups first, and add back to it. And if it rebounds and goes back to the high teens without me, that's great. As we said, when one bus gets away from you, goes away, another one comes. So there's no need to chase, to have FOMO. That's one reason why I'm only allowed to trade 2 to 4 days per month. As you guys know, one of my chief weaknesses is whenever I'm doing poorly, I overtrade to try to make back the losses. And so eventually, I'm a slow learner, but at some point that clicked where if something's not working, I need to do the opposite. So that helps me to slow down. If you look at the BBC chart, pretty ugly, today down as well. We had some bright things coming up, like there was an executive order today that Trump wanted to target the middlemen, the PBMs, get more transparency there. He wanted to, in the IRA, Inflation Reduction Act, he wanted to even the playing field as far as biologics, get the 11 years until price negotiation, where small molecule developers are punished, only 7 years. So that would be quite nice if that takes place. Provides a boost. There was also that commission report from the National Security Commission on Emerging Biotechnology, bipartisan report that came out basically saying how we are far behind or falling behind China. We're in a battle for dominance. The government needs to get rid of red tape, unnecessary regulations, prioritize innovation, help with the manufacturing, build the biotechnology workforce, realize the benefits that it provides to defense, prioritize the sector on a national level. So it was some pretty strongly worded stuff that, like I said, if that actually happens, translates into action in coming years, that would be nice to see biotech go from being the redheaded stepchild of the stock market to actually having some long-term tailwinds. So there is some silver lining there. In the meantime, while I was traveling, I'll finish with just a quick story. It's funny when people ask you how your sector's doing, how work is going, how life, and you're like, oh man, the market's down again, the sector's down again. This time around, my Airbnb was, I didn't get the location right. It was my first time at Airbnb. I didn't realize it was closer to a red light district. But the positive side of that is you meet some people in the street you probably wouldn't meet otherwise. So these are two guys. John, we call him Tokayo because he has the same name as me, John. But anyway, seeing these guys out there, they work construction, but when they can't find construction jobs, they're asking you if they can pick anything up for the store for you. They're washing windows. They're going out there and just getting after it and grinding. And so that's pretty, inspiring. And when I'm, or another friend too, he used to be a football coach, soccer, as Americans call it, for some well-known teams in Europe. And now he's back basically a parking lot attendant, wondering if he's going to be able to pay his rent this month, have some food, etc. So as my old man always says, compared to what? So it's always nice to, when the market's down, realize even though it sucks for us, there's other people going through worse things for what it's worth. I know that doesn't help much, but it's nice for perspective. Same thing with the Mama Liz organization. You've probably seen them before on my posts here and there. I'll occasionally share things they're doing. But these are kids in Venezuela who they have a super high rate of retinoblastoma eye cancer there. It should be like a 90% cure rate. Down there it's less than 50% because hospitals there don't have the things in place, the tools, etc. So these, she's raising money for these cases one at a time, chemo, MRIs. and so she has something like 6 or more kids in queue right now. So again, the perspective helps. Anyway, to close on something interesting, Aquesta Therapeutics, all these are names in DDQ. That could be interesting if ARS Pharma Neffy launch goes well. This could benefit as a sympathy play. Scholar Rock's been getting beaten down despite having the SMA treatment that could be approved soon. Xenon with a readout coming up for epilepsy, late stage, that would be their first approved drug. Axum, you guys know, is one I sold too early, looking to revisit that. PTC Therapeutics had some regulatory alignment with the FDA, including their Friedreich's ataxia program. I guess one of the reasons it got beaten down is FDA uncertainty. Agios Pharma is one that's actually kind of interesting to me as well down here. They have some sickle cell data coming later in the year. They have the thalassemia PDUFA date in August, I believe, and that's a drug where it's approved in PK deficiency, but that's an ultra rare disorder, so don't expect much from revenues there. But what is nice is there's a lot of clinical precedent for doing well in these heme malignancies, these PK activator drugs, and how patients feel better on them. So that could maybe be something that bodes well for launch, uptake out of the gate, because not only would the drug be accomplishing the goals with hemoglobin response, etc., transfusion dependence, but also patients feeling better. That bodes well for a launch. So I think they had some liver safety issues. I still need to dig into that KOL commentary, etc., and see if that's an issue. But at first glance, it seems like that's a one-off. We'll see, but that's definitely one to look into. Anyways, hope you guys are doing well, staying in good headspace, and let's hope for some better news as the the year progresses, including these trade wars and things that are distracting from hopefully some silver linings in the biotech sector. Cheers.